Do you know your numbers? Dun dun dun!
Hello everyone. Today we're diving into a crucial topic that affects millions of people worldwide. Your thyroid profile numbers. Do you know your numbers? Now the thyroid function tests or the thyroid profile numbers or thyroid tests, these are important numbers to know because if you stay informed about these numbers, you can maintain your health and know what to do to improve your health. Because the thyroid can affect everything from your metabolism, your brain function, your hair thinning, your energy levels. Do you feel fatigued? All of this can be affected by your thyroid levels. So let's dive into that and explore these important numbers so you can know what they mean. First, our topic today is understanding I want to write it big so you can see it. Understanding your thyroid profile numbers. That's the topic. And I'm going to break down what each of those levels mean for you. Okay? First, we have the TSH. What does TSH stand for? It's the thyroid stimulating hormone. That's TSH, thyroid stimulating hormone. This hormone is produced by your pituitary gland, which signals to your thyroid to produce T3 and T4. There's the T3 and the T4. So with the TSH, this hormone produced, like I said, in the pituitary gland, it signals your thyroid to produce the T3 and the T3 and the T4. Normal TSH ranges from 0.4 milli international units per liter and is considered normal if it's like from 0.4 to 4.0. These are the normal ranges of the TSH. Elevated TSH levels is anything above 4.0 milliliters per unit. And low TSH levels, let's see, we'll put here TSH, and this is TSH. Low TSH levels is anything below 0.4. Okay? Those are important numbers to know. This number here, the elevated 4.0 milliliters per, international units, milli international units per liter, if it's above 4.0, that is known as the hypothyroidism. And if it's below, it's hyperthyroidism. And I found this very confusing in nursing school because usually hypo means low. But in this case, hypothyroidism means it's elevated, it's higher. So I just couldn't wrap my mind around it. I had to really come up with some, strategic ways of remembering this. And matter of fact, it was just memorizing it, plain and simple. The TSH below 0.4, if it's under the 0.4, then it's hyper, which again, hyper means elevated in most cases, but in this case, it doesn't. So what do these numbers mean? Well, let's break it down here. So typically, hypothyroidism, like I said, is elevated 4.0 TSH, right? So what's happening to the T3 in this case? And the T4? So that all indicates everything as well as down here for the hyperthyroidism, T3, T4. Well, you know what? No. As well as down here, T3, as well as the hyperthyroidism, T3 and T4. Okay. The T3 is the triiodothyronine, also known as free T3. These levels range from 2.3 to 4.2, and this is important in your metabolism. The T4 is known as thyroxine or also free T4. These normal levels are between 0.8 to 1.8. Low levels suggest an underactive thyroid, and high levels can mean you have an overactive thyroid. There's also a thyroid antibodies test that your doctor can do. These tests can help diagnose autoimmune disorders like Hashimoto's thyroiditis or Graves' disease. This is an important test because elevated antibodies may indicate that your immune system is actually attacking your thyroid. So please get that checked out. Your doctor should be checking your throat regularly for swelling when you go for your physical exam. And in between checks, you should be checking your own throat for swelling. Now, the thyroid is a butterfly-shaped gland in the front of the neck that produces hormones, so please check that regularly. So in the hypothyroidism, the T3 will be low and the T4 will be low. Those numbers will be low. And I will break down those numbers for you as well. In the hyperthyroidism, the T3 will be high and the T4 will be high. So basically, that's how I had to memorize it. If it's hypo, it's the T3 and the T4 that's lower, but the TSH, the thyroid stimulating hormone, is elevated. And in the hyper, the T3 and the T4 are elevated, but the TSH is lower. So let's go over the T3 and T4 ranges. T3 normal range is 80 to 220 units per deciliter. And then you have your smaller levels in between. Well, not smaller, but these all add up as well. The T3 free normal range is 1.7 to 3.7. T4 normal range is from 5 to 12. And the T4 free 0.8 to 1.8 units per deciliter. Okay? These are all the ranges here. I mean, you can take a screenshot of it, but if you look at your lab values, they will normally have these ranges on there. And it really depends on the lab that you go to on these ranges, because some labs may give or take a little bit here and there. Some of them may go up or down in the numbers. So it really depends on the lab. I've worked in different hospitals and I've noticed in different facilities, one facility may say a abnormal range is here, and then I'll go to another facility and they'll have a different range altogether. So it depends on the lab. Every hospital, every clinic, every facility has a different lab. So, but the ranges are basically the same. All right. So these are the ranges here. I gave you the numbers already, but these are definitely the ranges here that you're going to look out for. So what does all this mean? You're looking at it and you're like, okay, Nurse Sabrina, that's chicken scratch. Like in the other screen, I showed you the levels, okay? So hypothyroidism can affect everything from your metabolism. You'll find yourself feeling fatigued a lot. You'll have weight gain, because think about it. Hypo, it's causing your thyroid, it's causing the metabolism to slow down. So with the metabolism slowing down, you will gain weight, okay? Because some people are like, well, I just started gaining weight all of a sudden and not even trying. I'm not even eating differently. Just, everything's out of whack. Cold sensitivity. Are you cold all the time? You're putting on a sweater when everybody's burning up. Like, why do you have that sweater on? It's like, 75 or 80 degrees outside. Well, it's because the thyroid is malfunctioning. I told you about the fatigue, feeling the weakness, the cognitive function. Hypothyroidism affects everything. If you have brain fog, if you're just like you're forgetful, or things are just not coming together, you're just feeling like, oh man, I can't get it together. You might want to check out that thyroid. Constipation. Because think about it, with the sluggish thyroid, we call it sluggish thyroid, meaning the thyroid is going, it's slowing down, everything's slowing down. It causes constipation, slows down metabolism, slows down the gut, the GI tract, and causing constipation. It can even affect your mood. Some folks go through depression. I mean, it affects almost everything. Sometimes people even say, I just haven't been feeling like myself. It could be any of that, any descriptions of that. you want to talk to your doctor about it. Because if you tell your doctor some of those symptoms, whether you're male or female, but it seems to affect women a lot too, because I'm noticing a lot of women are on thyroid medication as they get older. So just definitely stay on top of that with your doctor, and he or she will do some thyroid tests, because they're gonna be like, that could be something going on with the thyroid. And then there you go. It'll explain everything. Then the next one is hyperthyroidism. That's when the TSH is low and the T3 and T4 is high. Okay. Hyperthyroidism, that is the opposite of the cousin, hypo. The cousin, it can cause sluggish thyroid, weight gain and everything. But with hyper, it can cause you to lose weight. Some people say, I've just been losing weight. I'm not even trying. I haven't changed my diet. I'm not exercising. I'm not doing this. It's just the weight's coming off. And I'm feeling anxious a lot. They feel nervous a lot. They feel their heart palpitating. They say, I feel my heart racing all the time. And that's palpitations. So the thyroid regulates your temperature in your body. So that's why when you have the sluggish thyroid, the hypothyroidism, you will feel cold, because it's not regulating your thermostat, your internal thermostat in your body. With the hyper, sometimes people feel hot all the time. They're just like, I'm just burning up. I see a lot of, not a lot, but I've worked with some women who are like taking their jackets off and they're like, I'm just so hot. And a lot of that has to do with, having hot flashes and stuff like that. But it can also be the thyroid that's going out of whack. Are you feeling more anxious? Are you feeling like, oh my God, it affects everything. So be mindful of that. If you're not a normally anxious person anyway, if you're not anxiety ridden and you normally don't worry about stuff and stuff doesn't affect you, and then all of a sudden you're just anxious about everything or jumpy or irritable, yeah, you might want to get the thyroid checked out, especially if that's not normal for your behavior, normal for your mood. If you have changes in your menstrual cycle, if your periods are one way for most of your life and then all of a sudden you're changing up, well, that's something to be concerned about. And if you talk to your gynecologist about these changes, I can guarantee you he or she will do a thyroid test, because my gynecologists have been doing thyroid tests on me for years. So it's something that you definitely need to stay on top of. Some people are very shaky. They have the tremors. So tremors can be something else as well. There's other things that can be affected. But if these numbers are off and you're having those symptoms, it's probably the thyroid that's acting up and causing these symptoms. So why is it important to know all of these numbers? Because early detection can help you get the proper treatment that you need. You don't want to walk around moody. You don't want to walk around depressed and anxious all the time, or tremors, or, cold all the time. You don't want to have to experience that. That affects your overall quality of life, okay? So you want to stay on top of these numbers to make for sure you keep yourself at that optimal health level. And if you have a family history of hypo or hyperthyroidism, if you've heard your mom say she has thyroid issues, or your dad, sister, brother, anybody in the immediate family, even if it's an aunt or uncle, if it's in the family bloodline, it can be in your system. It could be in your health right now, and you want to take care of that. And these are simple blood tests that can be tested, that can be taken, and you can find out how to get your...
All right, Nurse Sabrina, let's get it together.
And these are simple blood tests that your doctor can order for you and can develop a treatment plan if it does become a problem, if these numbers are out of whack. You may already be diagnosed with either one of these conditions. Your doctor would have told you what your levels are. And if you do know which one you are, you want to stay on top of that and keep your treatment regimen. Whatever medications your doctors are giving you, you want to continue taking them so you can keep the symptoms at bay and it won't affect your quality of life. And continue following up with your levels at every physical. I don't know how often your doctor will want to check your levels, but just stay on top of that to make for sure, because they may have to adjust your treatment plan. If these numbers go up or down within treatment, they'll have to adjust the medication. And then, to make for sure you stay on top of that. So please remember to stay on top of these levels and continue communicating with your doctor when any of those symptoms that I explained to you, it feels out of whack. According to the American Thyroid Association, the thyroid function tests, they will measure the hormones that actually help the body use energy, stay warm, keep your brain and your heart functioning well. You want to make for sure you stay on top of those numbers. I've included a link below to the American Thyroid Association website. So if you needed more information, feel free to go there and learn as much as you can about your thyroid health, should I say. Because with a properly functioning thyroid, you will have better brain health, heart health, muscle health. It also affects the muscles. You won't have those tremors. It'll just keep all of your organs working properly. Because our body, it's the only body you have, so you want to take care of it. You want to make for sure you keep this machine healthy for as long as you can, so you can have a great overall health, mind, body, and spirit. So you got to keep that body healthy, because if the body's not healthy, it will affect your mind and it will affect your spirit. So please always stay on top of your numbers. Okay, that's why I'm always saying know your numbers, because by understanding your numbers, you can empower yourself to take control of your health and seek appropriate health care when you need to. Because if anything's out of whack, you won't know it. But if you're paying attention to your body and your body functions, like if 1 week or 1 month you're not constipating, then all of a sudden you're gaining weight and you're constipated, well, something's wrong, something's off. And if your diet hasn't changed, everything's the same, but yet your body's gone out of whack, you need to seek medical attention. Call your primary health care provider, whomever it is, whether it's a doctor, nurse practitioner, physician assistant. Contact them and let them know the symptoms that you're having so they can test your thyroid. And you can be proactive in your health. I'm always telling people, my patients, when they come into the ER, you want to be proactive about your health, okay? Do not be reactive, because when you're reactive, that means I'm seeing you in the ER complaining about something that's been going on for a whole week or a whole month. I've been feeling shaky, or I've been feeling anxious, and I've been constipated, I've been this, I've been that. And I'm like, well, why did you take so long to come to be seen? Oh, well, I've been busy. Oh, I've been that. You can't be too busy for your health, guys. Please, that's why I'm doing this series of Know Your Numbers, because if you know your numbers, you can stay empowered and you can stay on top of your health. And you can be proactive, meaning you're going to react before something goes wrong. You're going to stay on top of that health. You're going to take your supplements. You're going to stay healthy so nothing goes wrong. Now, you could do all that stuff, stay healthy, and stuff can still go wrong, sure, because as we're aging, things happen. Or you can have an accident, or an illness will come upon you. But if you're proactive and you're staying on top of it, you'll know right away when something's wrong, and then you can go ahead and react and get it taken care of. Do not be reactive about your health. Do not wait until something happens, because there's people who come into the ER who I ask, well, when was the last time you saw your doctor? Oh, I don't know. It's been years. Oh, I don't know. I haven't had time. Well, you don't even know what's going on. And then we're telling them, oh, you have high blood pressure. Oh my God, this is out of whack. I do? Oh, I didn't know that. Well, if you follow up with your doctor regularly, then you would know, and your doctor will know when something's out of range. So you go annually, an annual physical, which is every year. If you do that every year, the doctor will know when something's wrong, and then you will know when something's wrong, and you will know your numbers. So please know your numbers and stay on top of it. Stay on top of your thyroid numbers, blood pressure numbers, cholesterol, all of them. They're all important. If you found this video helpful, please feel free to like, share, and check out some of my other videos. I have a series of Know Your Numbers, and there's more information coming within this series as well. So I've included a link to my playlist, to the Know Your Numbers playlist. Please check it out and stay on top of those numbers as well. Thank you so much. I appreciate you for giving me even a little bit of your time today. I'm Nurse Sabrina Clayton. I wish you health and wealth, because if you're healthy, you are wealthy. Okay? Have a great day.